Most people are curious about EMDR and at the same time a little nervous. They wonder, will this be overwhelming? Will I lose control? Will I have to relive painful memories? If you have those questions, you are not alone. I want to walk you through exactly what happened in EMDR therapy session, step by step, so you know what to expect. I am a licensed clinical social worker. This video is for education only, not therapy. My goal is simply to help you understand the structure of EMDR in a clear and reassuring way. EMDR stands for Eye Movement Desensitization and Reprocessing. It's an evidence-based therapy often used for trauma, PTSD, anxiety, medical trauma, and other traumatic life experiences. Even though EMDR can sound intense, a well-conducted EMDR session is actually very structured, collaborative, and safety focused. You are never forced to talk about anything. Nothing happened without your consent, and you're always in control. Before any trauma process begins, EMDR always starts with preparation. This phase takes one session or several sessions. There is no rush. During preparation, the therapists take time to understand your history, your symptoms, and how your nervous system responds to stress. You will learn grounding and stabilization skills, tools that help your body come back to present moment if emotions rise. These skills are practiced before deep work begins. You also talk about pacing and choice. You can slow down, you can pause, you can stop at any time. EMDR is not rushed. Safety always comes first. Once preparation is complete, you and your therapist choose a target. This may be specific memory, a related experience, or present day trigger connected to the past. The therapist helps identify a negative belief like I'm not safe, it was my fault, or I have no control. You will also notice the emotions connected to it and where you feel it in your body. One very important thing to know, you don't have to share every detail out loud. Much of EMDR happens internally. You can summarize, you can use a word or an image, you can even hold the memory silently. Your privacy is respected. Next comes the part most people associate with EMDR, bilateral stimulation. This may look like guided eye movement, alternating taps, or alternating sounds. While following the stimulation, you gently focus on the memory, the belief, the emotions, and the body sensation. Processing happens in short sets. After each set, the therapist may ask, processing happened in short sets. After each session, the therapist may ask, what do you notice now? There is no need to explain, no need to analyze. Your brain does the work. You don't force anything. Thoughts, images, emotions, or sensations may shift naturally. People experience EMDR in many different ways. Some notice emotions rise and fall. Some see images change or fade. Some feel physical sensations, warmth, heaviness, tingling, or a release of tension. Some sessions feel intense, others feel calm or even quiet. Some people cry, others feel natural. There is no right or wrong way to experience EMDR. What matters is that your nervous system is processing, not how dramatic it looks. As the stress decreases, the therapist helps reinforce a positive belief. Something like, I survived, I'm safe now, I have control, or I did the best I could. Bilateral stimulation is used again to help that belief feel emotionally true, not just logical. That comes a body scan. You gently notice your body from head to toe. If anything remains, it's processed until the body feels settled. Every EMDR session ends with closure. This includes grounding, returning fully to the present, and making sure you feel stable before leaving. No one should leave an EMDR session feeling flooded or unsafe. If the work continues across sessions, it's paused carefully and closed until next time. A good EMDR session feels structured, contained, and respectful. You are always in control. You can pause, you can slow down, you can stop. EMDR isn't about relieving trauma. It's about allowing the brain to process what got stuck. To healing can happen at your pace. If you like to learn more, I'd link trauma educational resources below. And just a reminder, this video is for education only. It's not therapy.